Dr. Jaffe, are there any supplements that you think would be really good to combat joint pain?
I'm going to focus only on chronic joint pain. If you have an injury and therefore you have pain in a joint, someone who knows about how to help you recover from that injury, including supplements, but including good medical care, of course. So if we talk about chronic joint pain, the kind that afflicts many, not just older people, but many more younger people today are getting afflictions of the elderly. Now, joints are really quite remarkable. They're like shock absorbers. They allow us to bend and flex and hopefully stretch. But they also need to be repaired all the time. So one of the supplements that I think is necessary is called Joint Guard. Oop, I'm going to get this right. There it is. And this is what you would want a joint supplement to be. It has clear ingredients, glucosamine, not to be confused with glucose and amine. It turns out if you want to try to fool people, you would put in dextrose and ammonium chloride, because that will test physically as if it's glucosamine, but it's not. And it should not be in a supplement. It's a work-alike that doesn't work. So I recommend glucosamine and glucosamine sulfate and soluble chondroitin. What's chondroitin? Well, it's another connective tissue stimulating molecule, biologic, extracted simply, not with methanol, not with harsh chemicals. No, no. Nature's process. Traditional, medicinal. This is one of the most remarkable products that I know. If you try this 3 capsules twice a day for just 2 to 4 weeks, I think the chances are you will feel and function better, you will get more restorative sleep, you will feel more like being active, and that is a virtuous cycle. So I want virtuous cycles that include comfortable joints. Now, if there's one joint in particular that hurts, there might be a reason. For example, many people who use keyboards end up with a certain variant of what's called carpal tunnel syndrome. And I don't recommend surgery for that. I recommend enhanced repair and the use of a smarter keyboard and comfortable rest for your palms. So there's much we can do to allow our bodies to repair normatively, to allow our bodies to repair by giving them what they need. And I would say today anyone over 30 needs this kind of joint formulation, joint guard, something that promotes repair, something that makes you more limber, that keeps you from getting osteoarthritis. Now, what is osteoarthritis? It means bones on bones. It's uncomfortable. I can tell you from personal experience, it's uncomfortable. But I rehabilitated myself by using joint guard and other supplements that promoted well-being while I stayed well hydrated, while I ate whole, high fiber, high nutrient, low toxin foods. So joint health is related to overall health and fitness, to feeling and functioning well. You need a joint guard glucosamine sulfate, and soluble chondroitin in sufficient amount, which means a few capsules twice a day, in order to provide the basic building blocks from which your body is hungry and from which it can repair the joints.